Good morning. My name is Shannon Leonard. I serve as the Chief Compliance Officer for Cardiovascular Institute of the South. I want to thank Dr. Walker for the opportunity to speak to you this morning at the Digital Education Series. I'd like to talk to you a little bit today about the OIG, the Ultimate Compliance Office of Inspector General. I have no disclosures. I'm talking about OIG of the Human Health Services. Who are they? We talk about them, we hear about them all the time, but really, do we know them a little bit? And hopefully, I can teach you a little bit about who they are, what they do, what their objectives are, and how they affect our lives. So the OIG was established in 1976. They provide oversight for over 100 human and health service programs. Their healthcare spending is for greater than 60 million Medicare beneficiaries. They have a budget for their combined programs of over $1.3 trillion. They're comprised of over 1,700 public servants. They're the largest civilian agency in our federal government. It's a multidisciplinary organization comprised of the auditors, professional lawyers, economics, investigators, technology. All these folks make up the OIG. And so what's their mission? You know, why do we even have them? And their mission is truly to provide objective oversight to promote the economy, efficiency, effectiveness, and integrity of the HHS programs, as well as the health and welfare of the people they serve. And we're going to see that in their objectives, where they focus on efficiency and effectiveness. And you think, really? Well, why should I even care who the OIG might be? Well, I'll tell you why. In 2018, Medicare spending for OIG was greater than 740 billion taxpayer dollars. It's projected to be over 1.2 trillion in 2026, when the last of the baby boomers turned 65. The retirement of the baby boomers is projected to increase from over 60 million current beneficiaries to greater than 80 million beneficiaries. Well, the concern as well is that the number of workers per every enrollee will decrease about 35%, from 3.7 worker per enrollee down to 2.4. So much less tax dollars are going to be there for resources for this population of people. The rise in healthcare costs pose substantial Medicare financial challenges, as I mentioned, as large as they are, you can imagine. There's significant cuts to future provider payouts to reduce Medicare costs, and we're seeing that every day in our own practices. In America, we pay a payroll tax. Each one of us pay at least 6.2% of Social Security, and a 1.45% of our paychecks go to provide dollars for retirement and Medicare funding. Our employers match that. It's a 15.3% payroll tax for both the employer and the employee. In the South, as we care for our patients, approximately 62% of our patients have Medicare insured. And so reality is, most providers, most of us rely on Medicare funding to be solvent. So what's the objectives for the OIG? Well, they have three main objectives. First and foremost, their main objective is to fight fraud and abuse, waste and abuse. They also want to promote quality and safety and value in the programs and the people that they serve. And they're also looking at advanced technology and excellence and innovation to protect the information that they're entrusted with. So let's talk about those three things a little bit. First, about fighting fraud, waste, and abuse. The OIG conducts multiple investigations and audits and evaluations, and we as providers dread that, but it's also a way of protecting the funds, the resources for beneficiaries of the vulnerable populations. They're very aggressive pursuing those folks who defraud the HHS funded programs. But however, they also provide excellent assistance for those who seek guidance to improve their compliance programs. Their website has multiple educational resources on it for helping people that do want to improve their programs. They're financial stewards. They're trying to reduce improper payments. In 2019, there was an estimated $106 billion of improper payments paid out through the Medicare, the Medicaid, and the Children's Health Insurance programs. Now, not all of that was fraud. However, it was still improper payments that was intended to provide services for this population. So stewardship is paramount to ensuring that the beneficiaries get the benefits of the HHS programs. They're working towards billing and payment errors and improving efficient expenditures, and also overseeing and evaluating the grants and contracts that they provide for various agencies, and as well as fighting fraud, waste, and abuse. They hold the wrongdoers accountable and recover misspent public funds. They use civil monetary penalties and exclusions for fraud when they recover stolen funds, and exclusion from a federally funded program when 60+% of your patients have Medicare insurance. We certainly don't want to be excluded. They also impose penalty of a corporate integrity agreement. This is a very strict compliance program that's monitored on a routine basis, controls by the OIG, and it's a very strict reporting system. So what about promoting quality, safety, and value? Well, they have standards that are quality and safety standards for the vulnerable. I mentioned the 142 million beneficiaries involved in the 3 programs. They do inspections of hospice care, adverse events that happen in healthcare, in nursing homes and assisted livings. And we've seen some of that's been in the news recently with our COVID pandemic. You know, and we hear about the terrible things that happen in some of the homes and things that get away. They oversee thousands and thousands of these facilities that have quite a lot of success taking care of these patients in a safe manner, following the rules and regulations, the oversight that the OIG provides. They promote public health and safety. The OIG also have programs over the FDA and the CDC and the Secretary of Preparedness and Response. They provide medical support and coordination during public health emergencies. You know, if we just didn't have them, if they were not funded, they're not there, the food recalls, the danger that we find in different foods and people who have industries who've provided bad food or medical emergencies that they're not involved in. We kind of miss the fact that the regulations help us to have safety in our food supply and our devices, and that the devices that we use for our patients are safe and secure. And also supporting the high performing health and human services programs. And they have, again, trying to be efficient, introduce innovative payment and delivery models, such as ACO, medical homes, and bundled payments, which again may not feel good because it puts more demands on providers and their teams to make sure that all the things needed for those payments are done. However, the outcomes are intended to be better, and better outcomes means lower costs for the programs itself. And in Medicare and Medicaid reform, they both offer challenges and opportunities. We know we're involved in bundled payments as well, trying to make that as efficient as possible. And there's lots of challenges involved with that. So what about the advancement of excellence and innovation? And most of that is focused around IT uh, for the OIG. They are trying to improve efficiency and effectiveness. They're prioritizing their work and their data management, their analytics, just like we all do, but yet they're doing it on a much larger scale. They're using technology enhancements for task automation and data visualization. And uh, they're also leveraging risk for informed decisions. They're working through the various technologies that they have. They're also working towards using greater networking of automation. They're they're learning how to machine learning as well as artificial intelligence, and they're taking that information to help identify fraud and abuse in different areas and different particular services a lot sooner than in some of the old ways. And that's what the OIG is doing, trying to protect the resources available for the beneficiaries. They're modernizing their IT infrastructure for timely data. I know that sounds like an oxymoron, but timely data coming from Medicare and having available technology for their frontline staff. They're also using cloud computing now to develop and rapidly deploy large amounts of data sets. And then finally, implementation of their OIG, the new technologies, I've mentioned that, improve public transparency as well about their implementations, and modernize their audit and evaluation tracking systems. So what's their priorities? Let's talk about the top 6 priorities for the OIG. First and foremost, we've mentioned over and over, the safeguarding of the Medicare trust funds. You know, the concern is it's predicted right now that Medicare Part A is currently only funded through 2026, just 5.5 years from now. The Medicare cost is going to increase from 3.7% of our GDP up to 5.9%. The waste, it ranges upwards of 30%. On a $1.3 trillion budget, that's over $3 billion taxpayer dollars of that waste. And so they're trying to safeguard that money. They're also trying to strengthen and protect their fraud against fraud and waste and abuse by reducing the improper payments, having stricter controls on those eligible for these dollars. They find that often in improper eligibility of individuals receiving Medicaid benefits. In Louisiana, our current rate of residents in Louisiana is 39.6% are receiving Medicaid benefits. Are they all eligible for that? Again, that's what the OIG is trying to protect. And they're also using state Medicaid fraud control units to protect those Medicaid dollars that exist. The other is protecting prescription drug abuse. As we all know, the opioid epidemic is terrible. They're providing treatment access for those folks who are involved in the opioid use disorder. They're enhancing the fight against the treatment programs. They found fraudulent treatment programs. Then they're trying to stop that and make sure that the dollars intended to help patients in need of drug disorder, that the funding is there, and identifying barriers to treatment. They're working towards making sure that even those people who are currently being treated, if they have some interruptions from law enforcement, whatever, that they still have the benefit of staying involved in their drug use treatment. They also want to combat cybersecurity threats within HHS and healthcare. We certainly do that on a daily basis. You think about their programs with the multiple, they have over 142 billion records of PHI for those cyber criminals. And so they do a lot of audits trying to protect that information, concentrate on risk management and their IT controls. They're leveraging their technology, and, assuring complete and accurate, timely, and secure information using telemedicine and data monitoring systems. They're working with their technology engineers to ensure integrity of the data and appropriate oversight. And then finally, they using their non-traditional models for managing care, a reform to promote quality and efficiency and value of care. They're aligning their program incentives with improved healthcare outcomes. We know that through our MIPS program. It's all about the outcomes and the how well that patient does, and that way they can improve and use less resources. They're also trying to strengthen the program integrity. So the Ultimate Compliance Office, here's what they do. They have oversight of hundreds of programs serving millions of beneficiaries. They put a lot of effort to keep the Medicare, Medicaid, and the Children's Health Insurance Program solvent by preventing waste, fraud, and abuse. They put exertions to protect from prescription drug abuse and provide treatment for those that need it. They're stewards for over $1.3 trillion budget that's U.S. taxpayer money. They protect the privacy and security of the beneficiaries' protected health information, and their cybersecurity protection against nations who try to attack and get all that information that's available. And you know what? They do all that, and nobody wants to talk about them. Nobody wants to meet or be a part of the OIG. So I just hope that today that you got to learn a little bit more about OIG. You hear about it all the time. They have a big organization. They do a lot for our country. And, as a compliance officer, I certainly appreciate them in a different way as well. I want to say thank you for your time and attention in this. And if you ever need anything that CIS that we can provide for you, just look for the compliance officer there. Thank you very much.